So I just want to tell you a little bit about our journey with Jack. Jack was born, that was probably the first photo taken of him on September 1st, 2010. When Jack was born, and I should note, I did have a normal pregnancy, but whenever Jack was born, he was born with three anomalies. He had asymmetric crying facies, an extra full functioning thumb, which is really noted on this photo, and a sacral dimple. Because of the three anomalies, we started treating at Children's Hospital in Pittsburgh right away with a diagnostic referral service, just to see if there was a reason why he had the three anomalies. Into a few months of his age, he did start to have feeding problems. And through diagnostic referral, we started giving Jack a denser formula mix. Instead of what you would buy over the counter, we mixed it thicker. We decided, still working with diagnostic referral, that we needed to make sure that there wasn't another problem with Jack. He was experiencing low weight gain, but other than that, everything seemed fine. But the doctor suggested around the time his thumb and hands were forming that his kidneys would have been forming. And so that led us to have studies done of his kidney. We had the kidney ultrasound and a VCUG done. And that was around, that was January 2011. And at that time, Jack was found to have grade 4 VUR, and it was going to both of his kidneys. In February, Jack had a respiratory infection that he just couldn't shake. I took him to emergency room after emergency room. We had breathing treatments and whatnot. Finally, we had an echocardiogram done, and he was found to be in severe heart failure. He was neutropenic, and because he still had the low weight and low muscle tone, they did suggest an NG tube at that time. After we returned home from our 2-week hospital stay, we started all therapies with him. We did PT, OT, focused on feeding issues with him as well as textures. And even to this day, Jack still is affected by textures, but not so severely. And then later on, when it became appropriate, Jack started speech therapy. But whenever he started these therapies, he was between 8 and 9 months old. And even at this time, the therapist through early intervention, they told me later, they said they were very afraid to even touch him because Jack was just so like a newborn at that time. So in June 2011, Jack had a G-tube put in, and he started receiving his continuous feedings at night, and that has worked well with him. He still does have the G-tube, and that also for us was a blessing. Jack had been getting just yeast infections all the time from the padding on his face with the NG tube. So it was nice to be able to see his face and not have those problems. In December, we made our first trip to Kennedy Krieger Institute. And there, a lot of the pieces of the puzzle came together. And two of the most important things we learned were why Jack did not weigh what he should be weighing. And so we learned the difference between the fat and muscle weight, and we started amino acid supplementation. The most remarkable thing of the visit, though, was while we were waiting in the waiting room, Rebecca McClellan comes to Brian and Jack and I and says to just, "You must be Jack." And so then we realized how much these boys look alike. Jack has just finished his first year of preschool at the Elizabeth Seton Montessori School. He is very social and he has a lot of friends. As far as eating, he does still receive his continuous feeding at night, but he eats just like a normal toddler. He's an exceptional patient. He handles every appointment and every test with utmost grace, especially for his age. He's nearly 4. He always does his best. One of his therapists told me recently, if only everyone had his passion. As far as Jack's interests, he really enjoys watching TV and videos, playing on the iPad, and he likes to go to the playground. His favorite foods are cheese, yogurt, chicken and french fries, macaroni and cheese, and pretzel crisps. And as far as some of Jack's traits, he's very comical, he's easygoing, he's loving, kind, and empathetic. The most important thing to know about Jack, though, is he loves Disney World. Thank you for your time.